Let me speak a moment about our next presenter. His name is Lateef Ademola Lawal, and he's an architect, researcher, and university lecturer whose work focuses on the rapidly expanding field of healthcare architecture, particularly the birth environment. Lateef's research navigates the boundaries between the biomedical hospital environment, humanized architecture, and well-being. His work addresses pressing challenges, transforming and optimizing birth and postnatal environments in an era of birth medicalization. Lateef is contributing his voice, along with other international network of researchers and designers, to offer an enduring solution, creating better birth environment design and models, as well as inspiring postnatal spaces that not only consider birth as a healthy event, but also support women's needs and their emotional well-being throughout the birth phases. Lateef received his PhD from Victoria University of Wellington in Aotearoa, New Zealand, sorry for the mispronunciation, and previously worked with several architectural firms in Nigeria. His research interests include sensitive architecture for birth environments, biophilic design, and well-being. Please.
Thank you very much for that warm introduction, Davis. It's a great honor for me to deliver my presentation before these very distinguished researchers and experts, colleagues, as well as senior colleagues in the field. My presentation is about postnatal care environments in urban Nigeria and beyond. Permit me to say thank you, Doreen, because the very first time that we talked, way back in 2023, I never had the idea of how that small talks, we eventually lead. And here I am today, talking before the audience. I say thank you very much. I've also listened to the two speakers talking about birth, the situation, culture, as well as from the midwife perspective. I would say much of the talks here, centers around how might we improve the spaces where women give birth. And I can tell you that this is what we are doing. I'm an architect by profession, and this is what inspires me in my PhD. So let me begin. I've done much of the introduction. I will quickly go to my presentation. This presentation, we explore healthcare settings as healing spaces and places, global maternity rates in sub-Saharan and in the world generally, postnatal care in contemporary hospitals in Nigeria, the essential needs of postnatal women during postnatal, case studies, survey results, and the innovations and approaches that Nigerian government is trying to adopt, then looking ahead. Healthcare architecture as a healing space and recovery spaces. We all know that hospital is an important building for birth, for death, for safety, as well as for our well-being. Many years ago, the setting for sickness is usually at home, and at the same time as well, even birth did take place under the comfort of the home setting. But I think date back from 50s, 60s, birth has moved to the hospital. And then when we look at the situation in hospital, just like Lizzie has mentioned, there is a kind of contention between the practice in the hospital in terms of the culture, as well as the culture of the people, where birth is supposed to be. But in terms of safety, I think the medical personnel feels that the place for birth is actually in the hospital because of what they consider to be, they prioritize safety as well as to make sure that everything, goes well. Now, in the light of that, you will see that most of the hospitals that were designed, they prioritize functions over the need in terms of the physiology and the psychology of persons. Before now, there is this building designed by Alvar Aalto in Finland, 1932, that has all the features, that promotes wellness and well-being. External balconies, natural light, and views, they all support well-being, and they support the healing process. In response to all of that, in response to the medicalized environment that we have today, there is evidence-based research, and then some of these evidences, they are based on credible research findings. In Australia, Queensland, an architect there brought all of this together to design a children's hospital. It was built on salutogenic principles, creating some psychosocially supportive environment of patients, families, and as well as the staff who work in the hospital. The global maternal mortality rate. The report of the World Health Organization in 2023 indicated that about 260,000 women died during and following childbirth. Approximately 92% of all maternal deaths occurred in lower and middle income countries, of which Nigeria is inclusive. So this figure is actually disturbing. It's disturbing in the sense that in Nigeria, the figures continue to rise every year, year in, year out. So which gives a kind of concern to the government as well as people who work in the hospital. But these deaths can be prevented if appropriate measures are taken into consideration. So you can see the graph here. So it's around 983 for Nigeria, whereas when Lizzie presented in terms of the for the developed countries, it's about 962 in some other countries, which says a lot that why the global maternal mortality rates is actually reducing for the developed countries is growing for low-income countries. However, most maternal deaths are preventable with timely management and skilled healthcare professionals working in a supportive environment. A supportive environment in the immediate postnatal helps women to rest and recover, overcome fatigue of the birth process, and enabling smooth transitioning from the hospital to going home. Now, I need to pay some homage, to researchers who have done a lot. I would say their work, inspires me a lot when I was doing my PhD. Fahi Kathleen and Hani Jerry did something about birth territory, where they discussed the environment of birth itself, regarded as the sanctum, and the jurisdiction. The jurisdiction aspect talks about the control in that environment, whereas the sanctum, the surveillance and all of that, talks about the features of the birthing unit, the birth environment. After that, we have, I'm privileged to have Marilyn here. Thank you so much for what you've been doing. Marilyn and others build upon Faye Kathleen's work on birth territory to create what we called the birth unit design spatial evaluation to birth set. I'm happy you said she will be speaking on that very shortly. Newborn and Sing in the United Kingdom. Actually, they had a survey in 2003, also in 2005, where they focused on what women actually need in the birth environment. Jenkinson and others in Queensland, Australia, they published a document that serves as a guide for birth environment design. And we have Doreen, our work centers on color and lighting and in birth space. Nicoletta, yes, our work focuses on interpartum maternity care, but however, the very first researcher, she's retired now, whose work seems to focus on postnatal environment, happens to be Liz Mate. She resides in the United States. When I first saw her work, I had to email her, directly, and then, try to get, some bit of insight into what our work is all about. So I would say, just like Lepori Bianca, the Italian architect, focused our work on the birth environment, Liz Mate's work was actually on postnatal environment. Having said that, what is postnatal care, and how does the postnatal care environments, what is the relationship between these two? Postnatal care is regarded as one of the least focused in the maternity model of care. It provides an opportunity to optimize maternal health and well-being, support the transition to parenthood, and to promote good family health. Research in the aspect of postnatal care is limited, leading to an insufficient evidence to support postnatal care, including the nature of postnatal hospital environment to support women prior to going home. So what are the factors that could contribute or that could affect postnatal care? Number one is the medical conditions of women, nature of pregnancy, whether it's low risk or high risk. That needs to be identified during antenatal care. The second one is the types of birth. They talked about interventional birth, forceps, and the rest of it. The midwives, knows a lot about that. This could have an impact on postnatal care. Hospital environment, the noise in the room lighting, types of room, hygiene, and safety. One fundamental thing regarding postnatal care in hospital is the length of postnatal hospital stays. These has decreased in many countries. It used to be about 2 weeks, 1 week, so it it came down to 5 days, 2 days, a day, and then hours after the delivery. So this is an important factor that affects postnatal care for women. And of course, the last one is staffing. Now, most of the hospitals, especially in the less developed countries, there are shortages of staff. Many of them, they are poorly paid, poorly remunerated, and then so they leave their job, leaving the space with less staff to manage women. Now, what are the essential needs of postnatal women in the immediate postnatal phase? Now, that is the puerperium is very critical period when the women actually need adequate rest, sleep, for them to recover. Now, one of those needs during puerperium is physical restoration, meeting the needs of infants, learning the parental skills, as well as immediate postnatal care, support in the community, creation of a restful environment, and transition spaces. Now, the importance of design of postnatal spaces for postnatal care. The quality and the quantity of spaces, they contribute a lot in terms of smooth delivery of health care, assisting midwives. One of the articles I read, most of the time, they talk about, the midwives talk about lack of space, to provide adequate postnatal care for women. Another factor is, the length of hospital stays. They don't have the support, they don't have the spaces, so they just want to get the women out of the hospital. Now, the importance of space is very important for the midwives to actually perform their duty. Now, key features of supportive hospital postnatal environment. The designer of birth and postnatal environment need to have the knowledge and awareness about emotional and psychological dimensions of birth, including the physiology aspect of birth as well. That there should be a focus on wellness situation of women rather than the pathological aspect of it. And of course, very important is that after the process of birth, women need to return to normal activities of the daily life. So there's a need for salutogenic and restorative postnatal spaces that will assist new mothers to rest and recover faster, reduce stress, and enable midwives and nurses the opportunity to support women to smooth transition to parenthood. Now, here's a look of some of the healthcare facilities in Nigeria. So we have the first one there is it's a tertiary hospital. It's actually a university teaching hospital. Then we have the next one there. It's also general hospital, and the third one is also a tertiary hospital offering some degree of services to public, women, and children. Now, the model of care, just like in any other places, is organized in 3 layers. The first layer is the primary care. At the primary care level, we have the primary health care centers. And in Nigeria, we have more than 30,000 primary health care centers. And we also have the traditional birthplaces, which we call, in the local parlance, they are called ERBA. In some in some culture, these people are called the doulas, traditional, ski bath attendants. Now, the model of care at that level is completely natural, uninterrupted, free from hospitals' medicalization. At the secondary level, we have the general hospitals, and so we have the expert there. We have the obstetrics and gynecologists. We also have some midwives and nurses who practice there, and so they look after low to moderate complications during birth process. Then at the tertiary care level, we have the teaching hospitals. These are basically high-risk, they look at high-risk pregnancies and birth. The environment there is highly medicalized, and of course the birth philosophy is well bit different, from the other two layers. Now, there is in my PhD, there is a particular, I did a survey, combined with a small focus group. And so the survey there that we used was actually modified, to suit Nigerian situation, to determine what are those things that are important to women during postnatal care in terms of the environment, to support them. Now, we sampled 2 hospitals. Now, we had like 140 who participated in the survey. And then there were women who gave birth 1 day or 1 month in the 2 hospitals. And then the survey had like 4 domains: postnatal room features, interior room features, sensory environment feature, and the last one was the social environment features. Now, this is the survey. Postnatal rooms where women were attended. So about half of the respondents reported they had bright colors in their rooms. More than a third of women said the rooms were comfortable, and almost half of women considered their rooms to be restful. 61.4% of women said their room was lacking natural features, and nearly half said their room had no paintings of natural scenery. A quarter responded felt their rooms were quiet compared to women who did not feel so. Now, the combination of all the results, of course, I'm not presenting everything here, so indicated that women seems to prioritize cleanliness, especially during postnatal phase, cleanliness and the hygiene of room. So it was ranked as very important element in the room. Next to that was the room freshness and air quality in terms of getting enough ventilation. Then, of course, natural daylight. Natural daylight had like 71.5%. This is very important. Natural daylight is very important for both mother and baby, in terms of, for the baby, there's this bilirubin, breaking down of the yellow pigments, in the child, yeah. So it's very important, and both for mother and women. Then they talked about having additional heating for both mother and baby. Then, of course, a quiet room for recovery where they could have enough sleep and rest before going home. And then the issue of privacy is another important thing. Most women who are probably attended in open bay rooms or rooms that have multiple beds, there was this complaint of lack of privacy. People just go in, they just intrude. So it's an important element for women that if they could have opportunity to choose their room or have a private space for recovery, that would be great. Then noise control is also important, even though it's one of the least rated things. The result here is that well, no, we all know how hospitals are, in terms of it's a busy environment. So they felt that, to control noise, even though that is a good desire, but controlling it is not within their control. So pleasantness in rooms, aquarium, natural sounds and images. Yes, it was also important, but the women in my survey, they felt that hospital is just a hospital, and so they didn't have idea of how this element, can be brought to hospital. And I remember yesterday during our exhibition, we went around and saw the hydrotherapy room, and then that kind of things, and spaces, if it's possible, to have the sort of thing like that. Yeah, I believe that women will appreciate that, and then that will support them in the recovery process. Now, key spaces for women's postnatal recovery and well-being. And so they talked about single private spaces for postnatal recovery and well-being. And so here are some of the spaces that could promote well-being and recovery. And then a rich array of restorative interior features in terms of the color of the room, in terms of room admitting much daylight into the room, and of course some of the paintings, paintings of art and all of that could be introducing. And then there's an opportunity for women, to have access to the outdoor. So this is also important for their well-being in terms of when they are getting, especially for those that probably underwent, cesarean birth sections. So there should be an opportunity to move in from their room and to get into the outside. Now, strategies for improving postnatal care and maternal death reduction in Nigeria. So the government has launched in 2023, the government launched maternal mortality reduction, innovation and initiatives with the term MAMI. Now, this MAMI had like 6 components. Those 6 components, it talks about access. It also talks about health facility programming, as well as the community. These two resonate well with what architects, we as architects, what we can do. So currently, in terms of the facility, government is trying to inject some kind of funds whereby some of the primary health care centers, can be refurbished to accommodate more women, in the community. So these primary health care centers will serve as transitional spaces for women to go to after giving birth there. Now, some of the refurbished primary health care centers. So I have a collection of what has happened to them. And so this is the entrance. This is one of the postnatal care rooms, and then at the moment, some of these primary health care centers, they have been renovated. Unfortunately, these renovations were being carried on without recourse to the architects or without recourse to some of the findings, so they were just actually doing it, which I think, is just, business as usual. But in our own something, we are trying to, so going forward now, we are trying to see how architects, can actually reach out to the hospital management in terms of when they want to carry out, further renovations and refurbishment of rooms, so that the architects can be brought in, before anything is done. Now, there is evidence growing regarding design features required to transform postnatal care environments. Primary health care centers in Nigeria are being transformed, just like I've mentioned, to cater for the needs of postnatal women after going home. And then there is also collaboration, which is very key. Part of what we are doing today is that we are speaking with different professionals, in different disciplines, on how we can transform the birth and postnatal environment. Then there is advocacy. There is the Nigerian Institute of Architects. Currently is a woman that is the president, and I've been speaking with her. She's very, very much, enthusiastic and passionate about this sort of small but very important spaces. And then we are talking on how to even go further, trying to see how we can get the students at the level of architecture school to begin to get involved in how to design, some of these spaces right from the beginning, right from, before they leave school. So for the primary healthcare centers as well, she's been involved, and then we are working out ways on how we can introduce some of the findings to help us with the current and ongoing renovations that they are doing. So I want to thank you very much for this opportunity to present my research, and the opportunity, because it's a rare opportunity for me. For the first time, many of the people that have cited their work, they are here present. Lizzie Newham, Professor Maraline Fora, Nicoletta Davis, and a lot of others. I thank you very much. Do I have to wait for questions?
Thank you. I'll invite